And let me just apologize because I have to run as well. But I have some staff here, and they'll be getting the information back to me as well. Thank you.
Thank you, Congresswoman, and I want to be sure that we all understand her charge to all of us as we listen on the implementation efforts of the administration. We are very interested in understanding how we can help and shape the implementation before it's finalized, and the Congresswoman has asked to make sure that we do follow up with a report to her staff on how we can continue as these regulations and new commissions, etc., start getting formed, that we will be part of that process and help all of you help us make changes for this process. So it gives me great pleasure to introduce Dr. Garth Graham, who is the Deputy Assistant Secretary for Minority Health at the U.S. Department of Health and Human Services. Dr. Graham will be speaking on behalf of the administration overall, the Department of Health and Human Services, and the White House efforts on healthcare reform implementation and how we can better understand where we can leverage our expertise to help them. And I know that Dr. Graham has a PowerPoint.
I do, but I don't need it if we don't need it, if we don't have the ability. Great, we're good. Thank you. Thanks, Dr. Riz. Good afternoon, folks. Good afternoon, folks. Good afternoon. I want to thank the Congressman in action and also Dr. Rios for allowing us the opportunity to talk about something that we're all vested in terms of our time and efforts and passions. Certainly the opportunity to improve the health and lives of all communities, specifically minority communities, Latino and African American community, Native American, Asian American communities. There's a unique opportunity to do that with health reform, and I want to talk to you a little bit about, I think, are some of the key provisions, and then I want to tell you towards the end, and try not to dip into the other speakers' time, where we are with implementation. And a lot of the activities I'm going to talk about, we're co-chairing and leading also with the various implementation groups within the department. But suffice to say that I can tell you on behalf of our secretary, as well as other leaders at HHS, that the health of minority communities is at the forefront of our agenda as we move forward with health reform implementation. So 2 seconds in terms of the state of the union, as we like to think about it, in terms of health as it pertains to minority communities, and particularly the Latino communities, and why health reform is that unique opportunity. Certainly, many of you have a health background, so you're certainly aware of the fact that about 1/3 of Latino populations fall into that uninsured category. When we start to lay on the issue of underinsurance, i.e. those folks who have jobs or employment where they're offered some form of insurance, certainly you see that underinsurance is even amplified and amplifies some of the challenges that we face in terms of uninsurance and underinsurance. Underinsurance means folks who have a little bit of insurance but not enough to cover them if they're truly realistic. In some reports, up to half of Latinos don't have a usual source of care in terms of primary care, and Latinos have some of the highest rates of diabetes as well as many other chronic diseases. So if you marry on an accelerated rate of chronic diseases and marry on that with a lack of source of care as well as a lack of source of insurance, you can certainly see where, as Dr. Rios was pointing out in terms of some of the demographic changes that we're facing, this is not a Latino problem, certainly this is an American problem, and certainly how we take care of all minority communities is a charge for all Americans across the board. But certainly there are some unique problems, some unique opportunities, I should say, when we talk about the Patient Protection and Affordable Care Act. All right, so I'm going to give you 3 points, and then you can doze off if you forget all the rest. Insurance is important. If you look at the last National Healthcare Disparities Report, as well as the last National Healthcare Quality Report that was recently issued by the Agency of Healthcare Research and Quality, you'll see that over the last couple of years, the quality of care for Latino communities has been getting worse. And in fact, some of the disparities have actually been increasing. If you read through that report, you'll see that uninsurance and underinsurance, as well as issues around language access, is a key component to that, though not the panacea and end-all be-all of all of that, is a key component to that. So just the insurance aspect of this new law is going to be important for minority communities. 53% of folks who are uninsured overall are from minority backgrounds, and the highest proportion of that, as I just articulated, are from Latino communities. So just if you separate the impact of insurance potentially on minority communities, specifically Latino communities, you can see one generic benefit for this new law. And I don't want to underscore, I don't want to minimize that, because if we look at especially SCHIP data and Latino children in terms of asthmatics, we see that one of the most beneficial tools that has actually improved, if not reduced that rate of challenges with managing asthma in terms of looking at chronic illnesses. We'll see that having health insurance specifically for children is one of those key factors that have actually helped close that disparities gap. So if you start to extrapolate that back to adults and looking at all the things I just talked about, insurance is a key component for certainly improving the lives of Latino communities overall. And that's just one aspect of the law. I think we tend to focus on that because that's one of the broader components of the law, but there's more, like that ad on TV. But wait, there's more. Certainly, the law does a number of different things. I want to talk to you a little bit more about that. Section 4302 deals with improving data collection for minority communities across the board, but certainly improving data collection for Latino communities is particularly important. Why is that? Because there are actually very huge public health differences in terms of certain disease incidence and prevalence between Mexican Americans and Puerto Rican Americans. Take infant mortality, for example. There are differences between Cuban Americans and other segments of the Hispanic population. So when we say Latino overall, we certainly do an aggregate discussion, but the opportunity to improve data collection of various subsegments of the Latino population offers some unique insight into how we deal with the challenges and understanding that not one size fits all. So Section 4302 deals with charging the department I'm going to tell you where we are at Section 4302 after I leave you with kind of the three other points that I want to make. Deals with the department establishing new standards for data collection, but also requiring that all of the folks who receive federal funds collect data on race and ethnicity. So if we start collecting better data, but also we have the opportunity to expand in terms of potential optional standards, we'll start to delineate more and more what some of the problems and challenges are within minority communities, and particularly within the Latino community, as I was just alluding to. And that in itself is one potential benefit besides health insurance that I just alluded to. There are a number of sections that deal with promoting cultural competency and making sure that we create a more cultural competent, not just workforce, but also in terms of some of our reimbursement practices as it pertains to cultural competency. And so there are a number of sections, there are actually two sections in particular, that deal with this issue of cultural competency, which is particularly important to minority communities, and certainly particularly important to Latino communities as well. I forgot to tell you that Section 4302 not only defines standards in terms of data collection for race and ethnicity, but also looking at language access, and that's talking about how we collect data as it pertains to language, and that's going to be particularly important for describing better what the challenges are. So jumping back to where I was before, improvements in cultural competency, there's investments in terms of paying for and promoting promoters or folks within the communities who can help connect folks with care. We know from looking at data from folks in Los Angeles and folks in Texas that promoters, specifically in Latino communities, are very useful tools for connecting people with care. So there are provisions that deal with increased help for promoters, as well as various forms of community health workers. I want to save some of the workforce provisions to my folks at HRSA, but suffice to say that it addresses a low number of Latino healthcare professionals through scholarship and loan repayment programs, and that provides an opportunity to help bolster our workforce in terms of working with disadvantaged communities. One of the challenges that we saw with the implementation of universal healthcare coverage in Massachusetts was this issue of the primary care workforce. So we brought a lot of people into the system, and particularly if you look at some of the data that emanated out of Massachusetts, you'd see that certain communities were disproportionately affected by the lack of primary care physicians, even though they then had health insurance. So there are investments in terms of bolstering the primary care workforce. There's a new commission that will be targeted to improving our overall workforce and making some recommendations that the department can then work with. And this is going to be an important critical factor because insurance is one component, and don't underestimate the power of insurance, as I was saying to you earlier. But making sure once we bring people into the system that we invest in the primary care workforce. Also provides significant funding to community health centers. About 67% of individuals who seek care in community health centers are from minority backgrounds. So all of these are various key points in terms of potential areas where specifically, if you just take aside the insurance portion of it, there are targeted activities in terms of not only data collection, but improving the workforce as well as increasing access points to care, which I think will be important for minority communities overall. We're co-chairing the data work group, and we're taking very seriously some of these new standards that can be potentially developed for how we define data collection in minority communities overall. All right, I need to turn things over to the next speaker, but let me tell you something in terms of timelines. A lot of times when we're going out across the country and talking to various communities, people are thinking, this is something that's way off. This is something that's that is 3 or 4 years from now. There are things that are occurring right now, and it's important for our communities to understand what are the things that are occurring right now, as well as prepare for a lot of the things that will be occurring in the near future. So the elimination of pre-existing conditions, the elimination of pre-existing condition exclusion for children is again one benefit that I think can disproportionately benefit our minority communities, and that's something that's occurring right now. Plans must provide coverage for preventative services. That's something that's occurring right now. Other things that will occur in 2010 and 2011 timeline is creating temporary insurance program for retirees, as well as potentially increase reimbursements for primary care. And I told you how that primary care challenge can disproportionately affect minority communities. So certainly bolstering that portion of the system is going to be important. I'm going to leave some of the other things to... yes, I was going to get to that. Thank you. I'm going to leave some of the things to my other speakers, but two things. If you remember those 3 points I said to you, insurance is important in minority communities. Cultural competency as well as data collection are key provisions for understanding the challenges as well as opportunities for minority communities in the future. And certainly as we move forward, having folks be engaged across the board. So here's where we're at with implementation. I'm going to give you kind of the real deal in terms of where we need people's help. If we don't, so let me give you an example of where sometimes expansion of benefits sometimes is there, but folks don't take advantage of it. So for the past 15 or so years, Medicare has covered reimbursement for the flu shot, just overall. Well, if you look at the flu shot numbers for minority communities, you see about 80% of the general population takes advantage of that, but only about 50 to 60% of African Americans, Hispanics, as well as Native American populations take advantage of that benefit. So we have examples where we had expansion of potential benefits, but minority communities don't necessarily take advantage as much as we would like compared to the rest of the general population. And we don't want that to happen here. We want folks to understand what's coming. We want them to understand what's happening now, as well as what will be happening in the future, and for them to understand that they have to be actively engaged in the process for this process to work. So if you have avenues for care and avenues for coverage, but people don't take advantage of that because of lack of knowledge, then really all of this will be for naught. And that's something that's very, very real. So regardless of political beliefs or whatever folks believe beforehand, this is what's here now. And we need all folks, Republican, Democrats, people in the middle, people off to the left, right, center, whatever you want to talk about, to make sure that they make their communities aware of all of these benefits that are coming down the pipe. Dr. Rios reminded me that one of the best informational sites is www.healthcare.gov. That site went live July 1st as a part of the enactment of the new law. We have a Spanish version that will be going up soon, and it's very, very important for folks to be able to access. If you go to that site and you can just go to the timelines and you scroll over the top cursor, you'll see all the various timelines related to all the various provisions that I've talked about here today. So healthcare.gov is a resource, and in August we'll be going live with the Spanish version of healthcare.gov. So please ask me any questions as we go into the question and answer period. But I think that we're at a key point in our country's history where we can potentially change the lives of a number of individuals. So thank you.